So mostly good outcomes of torticollis. Well, you got to watch this video. 2 things can speed recovery. 1, an early diagnosis, and 2, sticking to the treatment plan. Now once torticollis is diagnosed and stretching exercises start, most babies improve fully within 6 months. If you can catch developing torticollis early in your baby, it is very treatable to recover rapidly. So 3 out of 100 babies develop and suffer from this after birth, but it often only becomes obvious at 3 months. So watch my other video, What is a Torticollis Baby? Find the link in the description or above or at the end of the video. Okay, I'm Dr. Chris MD, helping mums to be happy and raise healthy, happy babies. As a family physician, I've delivered more than 1,000 babies like yours, and I've coached tens of thousands of mums just like you with their newborns. So torticollis is a wry neck or a wrung neck, a condition in which your child's head progressively and persistently tilts or twists to the one side, and he prefers looking over his shoulder instead of straight at you. Let's see what the word means. It's actually a condition in which the neck is twisted and the head inclined to the one side, caused by spasmodic contraction of the muscles of one side of the neck. From Latin word tort means twisted, plus column means neck. Now let's do this, mamas. I show you or not. If you want to deal with a huge issue later, then don't look. In this video I will also share with you how you could even prevent some torticollis from occurring. Now during the last 40 years as a doctor, I've seen it all. I've seen what an effort it is to try and correct a skew neck that was not detected and treated immediately or early, and then cause shortening and scarring of the neck muscles, which affects the baby's entire performance, its feeding, its movements, sleeping, sitting, crawling, and further milestones, delays, or disasters. Nobody wants surgery for the little guy. I know how much you really want only the best for your baby. So lean in here and learn how you can treat this condition that occurs more often than you might think. So especially if you have maybe not even heard of this condition before, pay attention and just know about it so you are warned and armed. So benefits of knowing some hacks of how to treat gives you the edge on looking out for it and preventing, noticing, or treating it early and having a healthy, happy baby. That's what we want. Who doesn't want that? So simply applying some of the easy posture principles could prevent torticollis, as well as improve the development and strength and other milestones of your baby. Okay, let's look into this a little deeper. As you know by now, torticollis in the infants is quite common, 3 in every 100 babies. Now fortunately, in most cases, infant torticollis is very easily treatable. Okay, why does treatment matter? Well, if you act early, you can help prevent any long-term problems for your baby. But without treatment, your baby might otherwise get complications, including the following: less control of the head. They can have limited reach on the affected side and less tracking with the eyes, so they can't follow things. A problem feeding. They can be rolling onto the one side only. They can have crooked crawling and don't crawl straight because the neck is skew. Delays in sitting and walking, or they can have poor balance. Please subscribe and click like if you're getting value from this video. How to treat infant torticollis. Well, this exercise is especially useful for a baby with torticollis or even an additional flat head, and it can actually help treat both problems at once. So here's how to do it. Doing some stretching exercises for torticollis is most effective if started when a baby is between 2 and 6 months of age. Now the principle to treat torticollis is to encourage your baby to turn the head in both directions. Now this helps loosen the tight neck muscles and tighten the loose ones. So rest assured that babies can't hurt themselves by turning their heads on their own. So we're quite safe to do this, and baby will, if it gets tired, it will back off. Okay, so what can you do at home? You try to get your baby to stretch those neck muscles. It's the best treatment for torticollis. And like I said, it's totally safe. Now here are some torticollis exercises you can do at home. So use your baby's appetite as an incentive. So when your baby wants to feed or eat, hold the bottle or your breast in such a way that it encourages your baby to turn the other way away from the favorite side. Use your child's desire to eat to coax him or her along. So place toys so that your baby is forced to look both ways. So those with sounds and lights are really good at drawing their attention. So you can also talk or sing on the other side where you want them to look or turn to and face you. Get them to play with their hands and their feet. When they lay on the back, babies like to play with hands and feet, and they like to bring their hands together and their feet up to their hands. And when your baby does this, it builds up those muscles that they will need to crawl. You can also give them plenty of tummy time. Now that's important. On your tummy, perhaps, for brief periods while awake, is an important exercise that helps strengthen the neck and the shoulder muscles and keep the back of the head from flattening. Ideally, they should have 15 minutes of tummy time, up to like 4 times a day. You can support them on your chest, like backwards, or across your lap, or on a pillow if that makes it easier. Now, in addition to tummy time, do things that encourage your baby to move to the affected side, or to the side it doesn't want to go to. For example, if your infant normally turns his head to the left, then you should stand on his right side when you're changing him. Do the same when you place him in the crib. So for breastfeeding mothers, encourage your baby to feed from the side he doesn't normally enjoy. Now all of these movements can strengthen and straighten out your baby's neck. Here are some other exercise hacks to try, okay? Are you a righty or a lefty? So chances are you hold your baby on the same side each time you pick him or her up over the shoulder. So switch arms so your baby is forced to turn the head to the reluctant side. So you need to make the change too, okay? Now during play, draw your baby's attention with toys and sounds to make him or her turn in both directions. Okay, be gentle, not forceful. Just take it easy and baby will comply. Repetition leads to success. Now when putting your baby down on their back to sleep, position him or her facing the wall with that side that they are stuck in. So since babies are curious to look out into the room, your baby will actively try to turn away from the wall to the lazy side or the stiff side, which will nicely stretch those tightened muscles of the neck as they're looking over the room now from the curiosity. So when doing these exercises and your baby lays their head down for 10 to 15 seconds, now they're tired and they need a little rest if they don't want to hold it up anymore. Torticollis medical management is like this. If you find your baby's torticollis not improving with stretching or have any other concerns or lumps or defects, talk to your doctor or physical therapist. The doctor or physical therapist may teach you some more specific exercises, to do with your little one. These moves will also help lengthen the tighter short muscle and also strengthen and balance out the muscle on the opposite side. So when to see your doctor? If you notice signs that look like your baby might have torticollis, like I say, to the side or looking up, stiff neck, set up an exam with your doctor. Also make an appointment with your doctor if your own baby's treatment of torticollis doesn't seem to be helping, or if they develop new symptoms. Now additionally, if your child's torticollis develops after an injury or an illness, see your doctor right away, okay? The doctor will start by checking how far your baby's head will turn in each direction. They also do some measurements, and they also may order imaging scans such as x-rays or ultrasounds to check for other conditions. About 1 in 5 babies with torticollis will also have a hip problem. Most babies with torticollis don't have other medical problems though, but it's sometimes linked to infections, broken bones, allergy reactions to medicines, or genetic conditions such as Down syndrome or Klippel-Feil syndrome, a rare bone disorder of the neck. Physical therapy for the infant torticollis. In more significant cases, the doctor may suggest a physical therapist experienced with babies, like a physiotherapist, chiropractor, masseurs, etc., for more intensive treatments. Now, after treatment has started, the therapist may examine your baby every 2 to 4 weeks to see how treatment is going. And at these follow-up visits, the physical therapist will measure how many degrees the baby can turn the head and then help strengthen the muscles in the neck so that they can increase the range of motion. Now, they will also track any head shape issues and make recommendations about how to decrease any flatness that may be present. Now, very rarely, some children will require a helmet, but most will not. And as we can handle them very early, that's why they don't need a helmet. Rare cases. So surgical options. Thankfully, surgery happens only rarely with babies who have persistent torticollis that doesn't respond to conservative treatment. When physical therapy and home exercise don't correct your child's head tilt, then surgery may be required. Now, very few children with torticollis will need surgery to lengthen the sternocleidomastoid muscle to correct the torticollis. Now, this is the muscle that comes from the sternum and the clavicle to the mastoid is the sternocleidomastoid. Typically, your doctor will wait until your child reaches preschool years before considering surgery even. So, mostly good outcomes. Once torticollis is diagnosed and stretching exercises start, most babies will improve within 6 months. Now, two things can speed up recovery. One, an early diagnosis, and two, sticking to the treatment plan. Okay? Prevention. While mums often underestimate the value of exercise and activities for your healthy baby in the first 6 months, especially when we expect them just to feed, sleep, poop, change the diapers, and occasionally cuddle. In fact, this physical activity influences the baby's development in ways that aren't immediately apparent. It can also prevent muscle issues in the first year or so, like torticollis and stuff. Research shows that these early experiences shape a child's future in a myriad of ways beyond physical strength, showing evidence of cognitive or intelligence, social and perceptual development, and that an ability to balance can also be correlated with an increased aptitude in clever academic subjects like math. Okay, workout sessions for the infant should focus on balance and on strength. So parents can use their own body to support their baby, gradually increasing the kid's reliance on their own muscles by gently placing them off balance, where they must right themselves or correct themselves using their own motor skills and power and strength. You have all heard about tummy time and doing it. Let them lay on their back and play with their hands and their feet up in the air. Carry them high on your shoulder, needing to support themselves. Hold and play with toys, etc. And this is important to help development. Build strength and also power the muscles and get the coordination good. So for detailed information on what torticollis is and what causes it, watch my other video on what is torticollis. Simply click on the video link on the screen now, or in the link in the description below, or at the end of the video. Please like and subscribe and ring the bell to be notified when I post more important videos. How are you enjoying your baby? Do you have any challenges? Comment below. I'll make more videos. Just tell me what you'd like to know about. This is Dr. Chris signing off. Ciao mamas. Thank you for watching.